Hello there, listeners. It's Susie New from the Australian Society of Anaesthetists, and thank you for listening to our podcast. It's called Australian Anaesthesia, and it's where we talk about all things relevant to anaesthesia in Australia. In this episode, I'm chatting with Dr Anne Frankl, a paediatric anaesthetist who has also done some further training to become a coach. She has a particular interest in coaching other doctors. Now, I've got to admit that through my career, I've learnt a little bit about coaching. I've had my own executive coach, and I've also been in a leadership program which included peer-to-peer coaching in its curriculum. And I am a really big believer in the benefit of having coaching conversations. So what I hope we bring to this podcast is a deeper dive into coaching as a doctor for doctors. We cover the basics, such as what is coaching, and then we chat about how and why to become a coach. And I also wanted to tackle what it might be like if a coach and their coachee bump into each other socially or at a professional event like a conference. Because, you know, medicine can be a small world and it can feel like everyone knows everyone, especially when you're feeling vulnerable. What I really like is how Dr. Frankl shares how coaching can take a doctor from burnout to a sense of enjoyment and fulfillment with your career. I am increasingly hearing of people who have spent so much time, energy and money on medical school, particularly after having another career first, and wondering if they really want to pursue a medical career or even finish med school. So at the end of this episode, I'll share some opportunities to access coaching or further your coaching skills. All right, enough from me. Let's get into it. So thank you so much for giving up some time today to have a chat with me.
Oh, that's okay.
So you are a paediatric anaesthetist here in Melbourne?
Yes, I do a lot of ENT, which is paediatrics. These days I do quite a lot of paediatric dental. I've had a paediatric endoscopy list with the same endoscopist for 25 years. So
yeah, nice.
And then the adults that I do are the ENT and also plastics. So that's pretty much what my practice is these days.
So you've been an anaesthetist, predominantly paediatric anaesthetist for 30 odd years or so.
Yeah, a long time.
That's a great effort. That's
Thanks.
Really good. But you're now a coach.
Yes, I am a coach for doctors.
Ah, specifically for doctors?
Yeah, the course I did was out of America. It was called the Physician Coaching Institution. And so the lady who designed it was a physician, and probably about 20 years into her practice, she just did a coaching program and then went out of medicine and became a coach for doctors. And about 10 years ago, she realised that people coaching doctors kind of needed a special understanding of how doctors operated. And so this course is specifically for doctors who want to coach.
I see.
In the US, because they're always so much more ahead of us in this sort of thing, this has come from executive coaching in the corporate world. And so a lot of hospitals now have internal coaching programs. There were 18 of us on the cohort, and most of them they sort of call them internal coaches to their institutions rather than coaches, which is what I'm going to be.
Yeah. And in your cohort, were there many Australians? Was it
just
mainly
me.
Just you?
Me.
So, and mainly US physicians or medical people? Yeah. Okay. And why do you think, because I've been the recipient of executive coaching, so why do you think doctors are different or special?
I don't think doctors are special or different. We're all human beings and we all have the same sort of psychological makeup and same sort of psychological issues and the same sorts of difficulties communicating and getting our work-life balance. But I think that having been a doctor for 30 years, I understand the medical system inside out. So I understand the constraints and I understand the pressures. Yeah. So I think that that's why this woman decided that coaching doctors is a really good thing, because we just have a better understanding of a little bit of the doctor professional mindset, but also the way the system works and who are the personality types that we're working with and things like that, and the hierarchies and all of that stuff, and dealing with administration. Oops, hope that wasn't.
Sorry to all the administrators out there. No, but I suppose there's some efficiencies there, isn't there? Because you don't have to go around describing your industry to other people because they're within the same field. But there's probably other benefits too, I'd imagine. You know, you made that comment about the personality and the mindset of doctors. I can't remember the exact word you used.
Yeah.
But
Well, I guess a lot of us are sort of the type A, sort of high achievers, and understanding that mindset. Not that there aren't people like that in other industries as well, but I think knowing that the training we've been through, the experience that we have at work, the pressures of working within the hospital system, the pressures of working with patients, there's a lot of people skills involved.
yeah, that's true. Do you ever see yourself in the future coaching non-doctors? Because a clinician, especially as an anaesthetist, we're great, I think, at talking with people, establishing rapport really quickly, especially in paediatric anaesthesia. Yeah. And I could just see that your skills would potentially be, generalisable.
There's nothing to stop me coaching other people other than doctors, and particularly other healthcare workers I'd definitely be interested in. But for me, coaching is also a way of connecting with the younger doctors coming through and giving a little bit back to the community and the profession and to colleagues as well.
That's nice. That's a lovely quality to bring.
And the other thing that I feel is I'm particularly drawn to coaching women, and it's because I've been through all the different parts of my career, raising children, and that work-life balance, especially with female anaesthetists, is, unless you've been doing it or you've done it, it's hard to understand. Like when you're wearing the mum hat and then you're in theatre wearing the theatre hat, and then I used to metaphorically in the change room go, okay, taking off the scrub hat, okay, mum hat, which kid has to go there, what have we got in the house for dinner, blah, 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 blah.
Yeah. As soon as you start the list, I could just feel the weight of it coming on me now. and I really feel for trainees coming through now, because a lot of them, particularly in Melbourne, who've done postgraduate medicine, and because it is more competitive to get on the training program, are coming through older, and they're coming with children already in very early parts of their training. Like the adage when I went through was you try to get pregnant after your second part exam and have baby during your fellowship year, and that was the way everyone was told to combine their family and their professional life. But you can't do that anymore because you're losing that fertility window for women.
Yes. And as it turned out, I got married really young, so I'd made a commitment to my husband that we would have kids before I was 30. So actually I had my first child after my first part. So I was like way out there in terms of combining kids and training. So I was one of the first ones, and they kind of looked at me and said, are you sure you're going to do anaesthetics? Are you sure you're going to finish your training? And I'm like, I'm sure. But they had no idea at the time.
Wow. Well, you must have been a groundbreaker. Like there wouldn't have been many women.
Yeah, I was the first that I think that got pregnant and had a kid that early, and the directors were not happy.
I bet. And bet the words flexible training or part-time work didn't enter the conversation, or did they?
No. I didn't want to be trained differently. There was, in the 90s, there was no scope for it anyway, and I didn't want to be treated differently. So fortunately my husband wasn't a medico, so we made it work.
But it's that making it work. You have to put in effort to make it work, don't you?
Yeah.
I could see that having conversations with you would be so valuable, particularly for people who, I get asked this all the time about, should I do part-time training? If I do part-time training, I'm better off doing 3-month blocks full-time and then 3 months off. And I'm like, oh gosh, I can't answer that question for you. That's where you should speak to someone, right?
Exactly. But the thing about coaching is that I'm not a mentor. Coaching is different to mentoring. So when I see a mentor as someone who's telling you what to do from the benefit of their experience, whereas a coach helps you to find your own answer. So when you give that sort of, should I work part-time or 3 months on, 3 months off, the right answer is the right answer for the person. And nobody has that right answer except you.
Yeah, wow. Spoken like a true coach. It was good because it's been on my mind that we should, early on in this discussion, actually define what coaching is and perhaps what it isn't. So that's perfect segue into that now.
Yeah. So people think of coaches, they say, oh, are you a counsellor or a therapist? I am not. I do not have any psychological training. If I was confronted with someone who I thought needed professional help, then I would refer on. And whilst I feel like I have got a lot to offer in terms of mentoring, coaching is not mentoring. So what coaching is a partnership between the client and the coach. And the coaching mindset is that the client is a whole total person that doesn't need fixing, and that the client has their own answers within. And as a coach, we're trained to ask the right questions or helpful questions to help the client think about their situation in a different way. And so that's almost the biggest challenge for me, because in anaesthetics, your questions are so directive and you just want the yes, no answer, and you want to be able to do your anaesthetic consult in 5 minutes. Whereas as a coach, I have to turn my mind around and go, I have no agenda here. Here's an open question for you. What does this mean to you? How does this feel to you? Or what does that word or phrase mean to you? And I have to take away myself from the whole situation and go, I'm here for you as the coach.
You've made me think of two things. One is, as I said, I've been in a executive coaching relationship before, and there is that power. I remember a few times when my coach asked me particular questions and it was just like, penny drop.
Yeah.
How long have I been telling other people to do this, and I've never thought to turn it around and to do it in my own life.
Yeah, and I bet your coach was just watching you light up. They were like, that's a very rewarding moment for a coach as well.
Oh, I bet. And the other one is when I recently did a leadership program, we did peer-to-peer coaching and we talked about what coaching is and what it is not and exactly that. And it makes me think of two further questions actually. But the first one is, sometimes I'd be practicing my peer-to-peer coaching and I just want to come in with, don't you want to just do it this way? Give them the answer.
That is exactly right. And that's another challenging thing as a coach is it's not my agenda. And I might see a solution that I might have used before, or it's staring me straight in the face. But just like when you tell a teenager what to do, they're not going to listen. Unless you find the answer for yourself, it's not powerful.
Because that's the other part of that, is sometimes people will come to me with something. And I've heard this works with teenagers, but I sometimes take this moment to maybe frame our conversation. It's, do you want my opinion on this and advice, or are you wanting me to help you work it out?
Yes, and there's been a lot of work done recently, and there was a book by Charles Duhigg that talked about super communicators. And it's, do you want a hug? Do you want my help, or is this a social conversation?
Oh, that's a good one.
And then, because oftentimes, you come home from work and you just want to debrief your whole day and you don't actually want advice. You just want someone to listen to you. And that's a hug. So, yeah, those 3 different kinds of communication.
That's good, because maybe once you've set up as a formal coach, people are coming with the idea that you're their coach and it's a coaching relationship.
Yes.
But then, say, when you're at work and if people know that you're a coach and they're coming to you, is there this kind of moment of like, why are we having this chat? What are you expecting from me?
And I think that kind of framework is really, really good. So framing up a coaching session, there's a way that I do it every time. Just to sort of explain, what I'm offering at the moment is a 10-session session. I called it the Flourishing Physician. And it's looking at people, helping them gain self-awareness, understanding how they communicate. So it's really a greater self-understanding with a view to better work-life balance and more career fulfillment. I've set it up as 10 sessions, and every time we start the same way, and it's very much a Zoom coaching session. So it's in the box. And then there might be a bit of social chit-chat towards the end, but we know we set the intention, we get into the space, do a little bit of mindful breathing so that everything that's gone on in the day before drops away and you can be present to the conversation and to yourself. So people get trained in that very quickly, that, this is my coaching space. So I haven't really had the situation where people come up to me at work and want to be coached.
I like the first 2 elements that you mentioned there about that self-awareness and communication. I think are really important leadership skills.
Absolutely.
And ongoing. Like, I've done a few conversations on leadership, but I always think if I had to design a leadership curriculum, you would start with self-awareness, and from there you can learn about how you communicate, how others communicate, how you perceive, and that it goes from there.
And that, I think, is my next project, is coaching with a more leadership sort of lens. I started with the sort of work-life balance because that was close to my heart. But really the tools that I've learnt, because going back to the course, it was quite a robust course. It was 6 months of online training, and we went through a process with our colleagues. So we were coaching each other as well. So we got quite a lot of coaching experience coaching each other.
Pick up that thread a bit later, but I wanted to ask you, have you bumped into any of your coachees in a social situation? Is it a little bit like, if you see a potential patient on the street?
Yeah, I think it's exactly like that, because the confidentiality things are the same. And so I would let them lead. Like if I was bumping into a coachee at a conference or in a social situation, I would acknowledge that I knew them, obviously, but I would let them lead. And if it was a group of people, they might say, oh, I met Anne because she was my coach. But I wouldn't say, oh, how's this issue going, or something like that, obviously.
Because there's a moment of vulnerability.
Oh, absolutely.
As a coachee.
Yeah, absolutely. There's a lot of vulnerability. But I think it's important to say that it's all confidential.
I suppose that's one of the things with an executive coach is I didn't really have to think about that. We weren't in the same professional circles.
Yeah, I think that's a really good point to bring up.
Yeah, but if I were to get a coach within medicine, there would be a bit of thought that goes into that, and how likely it might be that we cross paths and how we'd handle that from my side anyway.
Yeah, and I think that my colleagues that were doing the course in America that were putting up or designing internal coaching programs, internal to their institution, I think that that's a challenge for them as well.
Yes.
Because a few of the people were quite high up in the hierarchy, directors of departments and stuff like that. And can I coach someone who is a direct report to me? And that seemed to be a bit of a sticky situation.
Yeah. Would they be in that situation, do you think? Is it like, with training, and you can't be a welfare advocate in your department if you're also a supervisor of training? We try and keep those roles separate within a department if possible.
Yes. And I think that you wouldn't want your department head to be your coach. You couldn't be vulnerable, could you? Like, how could you express your vulnerabilities if that person's responsible for your promotion or different project? There's no way you could do that.
Exactly.
So it's much better to be external to the whole situation.
Yeah, gee, that's added complexity for those internal coaches. I mean, good that they have them, and I'm sure that they would navigate that. Yeah. I want to come back to the training that you did.
Sure.
But before talking about that, I want to go back to that contemplative phase that you were in before you started training. So what stage of your career were you at then? What was going through your mind in terms of, yes, I'm thinking about becoming a coach, taking my next steps? Paint me a picture of what that looked like.
So I've been on this coaching journey for some time, probably between 5 and 10 years. And it actually stems from when I wasn't feeling so good myself in my career. My kids were in high school and everything was so busy. And now I know I was burnt out. I definitely was burnt out, but we didn't have the language for it then. And so I started going on a health and wellbeing journey because I thought, not eating well, not sleeping well, lose some weight, let's try and go from that avenue. So I found a different area of medicine that GPs do, training in lifestyle medicine. And so I started going to their conferences to find out about preventative medicine. And then I trained as a health and wellbeing coach to deal with people for weight loss and diabetes and stuff like that. And very quickly into it, I realized that I didn't want to coach those kind of people because sometimes they were needing coaching because they had to rather than they wanted to, and they weren't very well self-motivated. And so you'd say, well, did you go for your walk 3 times a week? Oh no, this happened and this happened, and I just thought, I can't do this.
Yes. I know, I get that feeling.
And then I bumped into an anaesthetic colleague at the Wellbeing SIG up in Cairns a couple of years ago, and she'd done this course as a coach, and I just thought,
it wasn't Sancha Robinson, was it?
It was Sancha, yeah.
Okay.
So Sancha's my mentor in this area.
Can I go back to the start of that? You now recognise that you were burnt out at the time. What were you doing? What was your life like? How much clinical work were you doing? Without getting too personal, how were things outside of work?
I was doing probably about 3 days a week. I was at Monash a couple of days a week and then in private 1 day a week. And I was teaching all the trainees paediatric anaesthesia, which was great. And I was on call. And then I had my Mother of the Year worst moment when I was on call and I had the afternoon off, so I was at home and I was on paediatric call, and I had to get back to the hospital at 5:30, like right when things were changing over. It was peak hour traffic. My husband hadn't managed to get home from work, and I had 3 kids. The youngest was probably in kinder, so kinder mid-primary school, and I had to bundle everyone into the car and go, Mum's got to go. And then we got to Monash, I got changed, stuck them in the tea room with the nurses, gave them a handful of change and said, I know you guys are hungry, but here's money. Like the oldest was 9, so she kind of knew what to do with the snack machine. I said, get you guys some snacks, sit down, Daddy will be here as soon as he can. And like, it was emergency theatre. The second theatre had to be open and I had to be in there. So that's when I started reassessing that maybe being on call with 3 young kids, with a husband who's not in medicine, who has his own work, and most of the time you're not needed as soon as you're on call. So that made me really rethink, and I went off call, and then I wasn't getting so much paediatric work at Monash, and so I decided to leave Monash. I was told by a more senior colleague that if I'm not enjoying what I'm doing, then it's time to rethink. So I did, and I left Monash at that stage. And then things were going well in private, kids got a bit older, and then I just wasn't enjoying it again, and I didn't know why.
Okay.
Like everything was hard.
And when you look back and say that's when you were burnt out, they were the features that you recognised, that you weren't enjoying it much. It just seems like it was hard work.
It was hard work, and there was just a lot of have-tos and not a lot of want-tos.
Yeah, that's a really nice way of phrasing it. And do you think going on this coaching journey and the lifestyle medicine and the health and wellbeing, has that kind of reinvigorated your interest and your passion in clinical work?
Absolutely, yeah.
Oh, really? Why do you think
things
so?
have changed. As you become more competent with the actual giving of anaesthetics, I've learned to connect much more with the patients, and it's actually the patients and the team in the operating room that I love. The anaesthetics, I don't do anything high-powered these days, but anything can be high-powered at some point. But it's the people and the connection and realising how important, as you say, our communication skills. Everyone, when I was training, said, oh, you're an anaesthetist, you don't know how to talk to patients. I'm like, actually, that's exactly the opposite, because I need to be able to talk to patients and get their confidence and trust with me within a couple of minutes.
Exactly.
So that's the bit I love now the most.
Interesting. So it's made you more present, I suppose, with the people around you?
I think so. I understand myself a lot better now as well.
Yeah, interesting. And yet the clinical work has stayed the same?
Yes.
From when you were feeling burnt out to now. So that's fascinating.
Yeah, and look, I've worked in private practice for at least 25 years, and some of the surgeons are still the same surgeons that we started working together as
exactly. It's really, really the same.
I'm like, when are you retiring? When are you retiring? Oh, no, I can't retire till you retire.
Yeah. So the next part of that sort of pre-contemplative I want to become a coach phase, you went into lifestyle medicine. And I've heard a little bit about that, but can you tell me what that is?
Lifestyle medicine? That's an up-and-coming specialty out of the States where people really focus on preventative medicine, and it's really prevention of chronic diseases. So focusing on lifestyle rather than prescriptions
right. So I want to sleep more, I want to eat better, I want to exercise more.
Exactly. And getting all those healthy habits ingrained in people and looking at the evidence behind which is a healthy diet really, and not all these fad diets, and what amount of exercise is important. So the people that become board certified in lifestyle medicine do all of that. And I decided early on that I didn't want to re-specialise in another area of medicine. So coaching was a way to find a way to help people without having to get another qualification in medicine, which was much more difficult than getting a coaching qualification.
Yeah. So you were going to their conferences and learning, which I think is really interesting. Maybe I should go to a lifestyle medicine conference at some stage. I'm curious about it. And then you heard about this program, the Physician Coaching Institute. Did you do much research or look into other coaching courses? There seems to be a lot out there.
I chose this one specifically because, well, 2 reasons. One, because it was a physician's coaching institute, so it really focused on coaching doctors. And the other reason was Sancha recommended it, and she's one of their instructors, and it's a really robust program, and there's an association called the ICF, which is the International Coaching Federation, and this course has a very high accreditation with the International Coaching Federation.
I see.
Coaching's very unregulated, and so they're regulating themselves. I thought it was important to have a highly credentialed course.
Yeah. I can see that. It gives you credibility.
Yeah.
And are you a member, or does the International Coaching Federation take individual members?
Yeah, so I'm a member of their coaching federation, and then there's different levels of coaches according to your amount of coaching experience. So I'm just a regular member at the moment, but I'm hoping to go up the ranks once I get more coaching hours and then pass a couple of exams as well.
Okay. Before we go into that, maybe we'll talk about the Physician Coaching Institute course. So you said it was 6 months.
6 months of online training, and it was a really robust course. We learnt a lot about the physician mindset and different tools to help people understand themselves, what they wanted out of their professional career. Because Francine, the person who is in charge of it, physician in charge, I guess, or coaching in charge, she had so much experience coaching doctors that she could see lots of different categories. And so she's taken a lot of coaching tools and put them in a way that are really good for doctors.
Oh, I see. And she's a doctor herself.
Yeah, so she understands. So people coming to her for coaching for things like, I've invested so much in my career and my education, and I actually don't like being a doctor. What am I going to do? And the truth is that these people really liked being doctors, but there was some mismatch with the institution they were working with, or the type of work, or the type of patients. And so there was an exercise that she took them through that was called a values clarification exercise. Particularly what's important to you. You've done this. And so once you know what's important to you, you can go, okay, well, I had this experience in working in this project. That was really good because it lit me up, because relationships are important, honesty important, all of those things. Like, what's important to you is what worked. And then you're taken through a process of, well, when were you feeling bad? When was work not good? And you're like, oh, well, I didn't like this surgeon. I didn't like the type of surgery. The hospital administration was terrible. And you go, oh, okay, well, actually, I still like medicine. I still like doing what I'm doing. Just there's a values mismatch. And learning that about yourself is huge.
Oh, absolutely.
As from everything else. So that's one of the huge tools that I've learned, and there were many, and there were so many.
Oh, that sounds amazing. So it's 6 months and it's online. So were they live?
Yes.
Are you having to juggle the time difference and sit there in the middle of the night?
It was disgusting. So there were 12 webinars, and then there was what she calls a kickoff weekend, which was like 8 hours straight, Saturday and Sunday, and then a capstone, which was the same at that other end. And then in between there were hour and a half webinars once a fortnight, which I did it from September 23 to March 24. And so in the beginning, the webinars were 1 a.m. to 2:30 a.m. And we time, like daylight saving
rhythm is just saying sleep, 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 sleep,
it was
sleep.
3 a.m. to 5:30. It was horrible. And but we had to turn up to 10 out of 12 of them live, because we did buddy coaching. They were really good with the Zoom rooms, and so you got put into a room and you had a little coaching exercise to do in the sessions as well. And then we had coaching gyms as well, where we coached each other. And then we had all these assignments that we had to do with each other outside of all the webinars.
Oh, wow.
So that was actually easier to find a time, because 8 a.m. our time is a good time for them, but 3 a.m. is not such a good time. Well, it's good for them, not for us.
Was there much difference between, because, most all your peers would have been American on the course,
yes,
and their system is slightly different, and their culture is also different. Yeah. I could imagine that would have been just very educational. But
it was fascinating, their hierarchies and the way medicine works there, so different.
Yeah. And then did you find that, was there a bit of a cultural adjustment to then working with Australian coachees?
No, I don't think so, because the sessions that we had, they were either structured so that we could learn to use the tools on each other, or it was practicing the coaching skills. And so when you practice the coaching skills, you bring your own topic. So, for example, one of my topics was that one of the things I really struggle with at the moment is the generational change with nurses and having to learn a new way of communicating with the younger nurses. And so I brought that's a really good example of a communication issue that I discussed as a coachee. But everyone has the same intergenerational different communication skills, and I'm pretty sure I'm not a dinosaur or a unicorn, I should say, that area of how to engage the next generation without intimidating them.
I think that question will be everlasting. So now you are a fully qualified coach after
Yes.
doing that course.
Yes,
And then you maintain your registration with the International Coaching Federation.
correct.
And you need to do the equivalent of regular continuing practice development to maintain that
Exactly.
accreditation. So you can't just
Yeah.
have done your course and go, okay, I kind of coach my husband and that's enough.
I mean, you can, but that's not me. So I'm involved in a couple of mentor coaching groups, and that's part of our continuing education, is that at times we'll be able to record a coaching session and take it back to the mentor, and they can say, well, hang on a sec, here's where you could hone your coaching skills a bit more, and also bringing potential sticky situations that you've had in coaching sessions to someone who's more experienced. So definitely a network that I want to continue, because that's the only way I'll learn.
Yeah, exactly. And I think, again, coming back to that leadership, there's so many crossovers between coaching and leadership. And in fact, I think coaching and learning how to coach is a really good and important skill of leadership. But also that building and establishing, maintaining a network as well is really important. I want to just finally come on to, you've gone down the entrepreneurial path, unlike your American colleagues, because they're sort of in-house. How are you finding that journey so far?
I'm in the very early days of it, and obviously this is very helpful to me, this podcast. And so it's basically getting the word out that I'm around and I'm available. And so starting in the anaesthetic patch, where at least some people know me, and I'm happy to coach any sort of doctors. So I talk to the surgeons that I work with, and I'm basically at the stage where I'm talking to everyone I can about coaching and just putting the word out there, and something will come back. And so my next thing to do is to craft a workshop that I can deliver on Zoom that will introduce people to coaching and also be a wellbeing CPD workshop, and offer that to ASA members. And so if you have to turn up on a Zoom thing, get something out of it, get an introduction to coaching and get CPD points, I think that's really a great way to start, to build awareness.
Great idea. Did you always think from the start that you would go down the entrepreneur, and I say entrepreneurial, it's more like, I want to set up my own entity?
Yes.
Did you, are there any other options?
I don't think there are.
Are there sort of big professional companies that do coaching that then you can be an employee of? Or once you've got your coaching qualification, do you basically have to launch your own small business as a coach?
No. There's definitely people that I know and I will explore. There's a woman who's got a psychology background who has a business coaching for doctors.
I suppose there's opportunity for coaches to get together and perhaps become business partners as well.
Yeah,
I suppose what I'm curious about is, if you say do the course, 6 months course, and you get registration with the International Coaching Federation, it's like, what are your work opportunities like after that? Is it that you have to become a small business private practitioner, or can you join a company and work with other people?
And I think it's all available, but I don't know that there's many people coaching doctors in Australia as yet.
Do you think there needs to be more?
Oh, I'm pretty sure there does.
Are people coming out and saying, I wish I had a coach, or I wish I had one sooner?
I think it's one of those things, you don't know what you don't know. It's so new in Australia in terms of the medical field that people don't actually realise that this resource is available to them and what it can do for them. So I guess part of my job is education, create awareness, and see where we go from there.
Yeah, that's true. What do you think your week will look like, your working week?
I'm planning to do a day a week in coaching, and I expect that over the next 2 years my anaesthetic practice will dwindle as my surgeons retire, and I want to do less. And so I've given myself 2 years to kind of flip it and do a couple of days of coaching and 1 day of anaesthetics, and then just totally pivot into coaching.
Nice.
And that sort of gets me a lot more flexibility in terms of when I can work and how I can work.
And it's great because you're still using your mind, you're still engaging with people, still having great relationships.
Yeah, and it's a bit less physically challenging than being in an operating room all day.
Yeah, it is. People don't understand how physically challenging it is being.
Yeah, and particularly in private practice, on high turnover paediatric ENT lists, that's 8 hours of remember to have a drink of water, Anne.
Exactly. I remember when I was a trainee, someone said to me once, it's like, Susie, you are so wide awake in the morning. And I'm like, yeah, because by 7:30, I put in an art line, a Swan-Ganz catheter. It's like I have to be on.
Yeah, exactly.
Oh, look, it's been wonderful chatting with you. Is there anything else that you want to say about coaching, or come visit me on my website, or book in for a session? Is there anything like that you want to say?
All those things. So my website's drannefrankl.com, and I'm open to, if you've got any ideas for me, if you've got any connections, if you want to have an exploratory session, all of those things. If you want to ask more about coaching, I'm here to answer questions.
Awesome. Thank you. Thank you so much for your time today, Anne.
Oh, you're very welcome, Susie. Thanks for the opportunity.
Well, I hope you enjoyed that conversation with Anne, and I hope it's given you a bit to think about and perhaps reflect on where your life is, work-wise or otherwise, what goals you have, and whether you might benefit from some coaching. As I mentioned at the start, there are plenty of opportunities to explore and learn more, or even experience coaching for yourself. First of all, of course, feel free to reach out to Anne. As I've mentioned in other podcasts, this podcast does not mean in any way that the ASA endorses Anne as your coach. We at the ASA, I like to showcase some of the innovations and side gigs of some of the talented anaesthetists of Australia. So yes, if you're considering a coach, look at Anne's website, but also feel free to do your own further research. Anne's particular coaching areas of interest are wellbeing, coaching for exam success, and also, as we discussed, communication and leadership skills. If you're still not sure and you are an ASA member, then keep an eye out on your emails and the events page on the ASA website, because Anne is planning to conduct some workshops for ASA members. And of course, I'll put a link to the events page in the show notes, as well as a link to Anne's website. And finally, if you are a woman or non-binary anaesthetist or pain physician in Australia or New Zealand and you have specific career or leadership goals, or if you are a man who wants to be involved with coaching and mentoring the next generation of leaders, then I encourage you to get involved with WELI. WELI stands for the Women's Empowerment and Leadership Initiative. It's a 2-year program that's based on work done by the Society of Paediatric Anaesthesiologists in the USA and includes elements of coaching and mentoring. Yes, I have a conflict of interest as I'm one of the founding members of the Australian and New Zealand chapter of WELI. However, we do very thankfully receive support from the ASA as well as the college and SPANSA. If you want to learn more, then I encourage you to listen to episode 83 of the Australian Anaesthesia podcast, where I do a deep dive with 2 of the founders of the US program, Professor Nina Deutsch and Associate Professor Larry Schwartz, and also learn more about what they got out of it personally. All right. In the meantime, while you're pondering, reflecting on your life, your goals, those are the people around you in your community, your loved ones. I hope that you, all of you, are staying safe and well out there.
This has been Australian Anaesthesia, produced by the Australian Society of Anaesthetists, with many thanks to host and editor Dr Susie New, with music by Soda Lime Music, sound and engineering by Bearview, and graphics by the ASA Communications team. For more content, please visit www.asa.org.au.